This is where the train metaphor comes in. It's like you're sitting on a train, you're looking out the window, and we're going to stop at a station. I don't want you to get off.
You've discussed doing EMDR.
Love it. Saved my life. The first thing that happened was I was guided to seat myself on a train. Did you do it this way where you watch it pass you by?
Welcome back to Anchored Minds, the space where we explore the intersections of mental health, neuroscience, and the human experience. Today, I'm thrilled to welcome a very special guest, Sandra Pelka, a seasoned therapist who brings over 30 years of experience as a social worker in child welfare and 20 years in private practice. She holds a Master of Social Work and is a trained EMDR practitioner. If you've ever heard the term EMDR, eye movement desensitization and reprocessing, and wondered what it actually means, or how it differs from traditional talk therapy, this episode is for you. We're diving into what EMDR is, how it works, and who it helps. And if you're curious about trying EMDR yourself, we'll also share tips on how to find a qualified therapist in your area. So let's get into it. Welcome, Sandra. Thank you so much for coming today.
Well, thanks for having me, Lana.
Yes.
This is very exciting.
Isn't it?
Yeah.
So I've invited Sandra here today to talk about this modality of treatment. And it's, it's something different that when I'm in conversation with people and I've asked them, what is EMDR? They don't know what it is. So I've brought Sandra here to tell us what it is.
And it's quite a complex psychotherapeutic modality. So today I wanted to make sure that I was giving enough information. So I wrote some notes down actually so I could reference, because there's a lot of different protocols and steps and scripts that are included in EMDR. But it is a psychotherapeutic modality. And what it does is it assists a person. Certainly we hear this for people who have complex PTSD or PTSD, or big T trauma. But it really is applicable for anyone because we all face adversities. And it is something that when we go through the phases, it opens up neural pathways and it helps.
Neural pathways are?
In our brains.
Okay.
And it's where we store information.
Okay.
How memories get stored. We typically think of memories as being an image, but it's all of our senses where information gets stored in the body. But this looks at dealing with our emotions and some sensory information. And at the time when we've had a traumatic event, some of that information is either stored maladaptively, or we don't have all the adaptive information we need, and hence it causes a lot of tension. So when we enter into these neural pathways, we're helping clean out the tension by bringing in adaptive information.
Okay,
and
so
that
what is adaptive information?
That's where we understand that if this incident wasn't my fault, I don't have responsibility, or it's over and I am now safe. So information that we may not have, even though as a rational adult, we may understand that, but the body isn't feeling it. And so that's what's telling us.
You want the mind-body connection.
Correct. Okay. It replicates when we get into a particular phase. The eye movement piece is where we use dual attention stimulation, bilateral stimulation.
And what does that mean?
And so that means it is side to side.
Of your brain, like different sides of your brain?
So what we do traditionally, how this was developed by Francine Shapiro in 1987, she used hand movements. So you sit in front of a person and you move their eyes. And that replicates what happens when we are in REM sleep, rapid eye movement.
Right. Okay. Your eyes move rapidly, hence the name.
Correct.
Okay.
So we go to sleep, we get into that phase of sleep, and we are processing the day's events, and then we're just storing that information.
Okay.
So when we're replicating that by going from side to side, and we can do it in different ways, I can talk about that later. That's when we find the right target, we open up those pathways.
Okay. All right.
Yeah.
So what does a session typically look like?
Okay, well, A session, so that's what I wanted to mention first before
Mhm.
we just talk about what happens in a session, because there I think we are looking at, with the advent of social media, and people tend to think about EMDR therapy only as the phase 4, when you get into the
Right. So there's
desensitization
multiple
phase.
phases?
So there's multiple
Okay.
phases, and this is where I'm going to help people understand this very quickly. So it's 8 phases, and the
Okay.
first is history taking. So somebody's coming in, and this is just regular psychotherapy. Like, I'm going to come in and do a biopsychosocial, right? I'm going to ask
Mhm.
a lot of questions trying to gather.
Biopsychosocial meaning that you're going to ask questions about all aspects of a person's well-being.
Yes,
Okay.
absolutely, because I'm looking at not only belief systems, but I
Mhm.
want to know how things feel. So that leans more into somatic and polyvagal theories.
Okay.
Um,
So put a pin in those because we'll have to talk about what those are.
correct.
Okay.
Okay. So we do the history taking, and that may take at least a couple of sessions, right? And
Okay.
during that time, too, it's really important that a person is just coming in and starting to know who I am as a
Mhm.
therapist, what the environment looks like, and are they starting to relax and feel comfortable? And then it's really important that we start to build a trusting relationship. So it doesn't matter what kind of therapy you are going for. One
Mhm.
of the most important things in having successful therapy is that you have a good therapeutic relationship, a trusting relationship with your
Right.
therapist.
So you need to vibe good with your therapist.
You need to.
Okay.
Okay, so we start there and then we go into preparation. So in preparation phase 2, I'm looking at what resources people have. And what I mean by that is, um, do they understand? Can they dip into their bodies and
Okay.
notice what's happening?
So if they have the ability to recognize these things?
Yes. Because for people in particular who may have experienced bodily trauma, it may be harder for them to allow themselves to notice what's going on in their body. So I'm asking some gentle questions, and
Mhm.
I'm exploring that.
Mhm.
And then if they need resourcing, how easily, when they start to feel elevated emotionally, are they able to come back to a state of more calm feeling?
Okay.
So
So how do they learn that?
what I am doing some psychoeducation.
Mhm.
Um, Usually in the first session, I'll say, have you ever done counted breath? And if
Okay.
they haven't, we're doing it in that session because they're going to walk out
Yeah.
with one tool.
Right.
Right.
Absolutely.
And it's amazing how many different ways we can breathe
So we
that
have
help
lots
us.
of tools that you can learn today and then walk out with it if you
Right.
can do it during your session.
Right. I do a lot of visual imagery exercises with people.
Mhm.
And for those who are unable to close their eyes and see images, that's a
Mhm.
particular neurodiversity, we can do other things,
Okay.
such as the 5-4-3-2-1 technique is an example. That's bringing in our senses, and it just
Okay.
helps you ground yourself.
Do you count
So
and
you
then
look
go?
at like 5 things I can see,
Okay.
4 things I can hear, things, and then you go down and you go through
Okay.
all the senses. Last one is 1 thing I can taste.
Okay.
And it just brings your brain back into the present moment.
Right. So it calms your amygdala.
Right. So it gets you nice and calm.
Mhm.
So I'm in that preparation phase, that's going to take as long as it takes.
Yeah.
And depending on what a person's life experiences have been, some people may stay in that phase for a very long time. We may be doing more what is traditional talk therapy, where we are exploring some things, like I'm helping them make
Mhm.
connections of what may be happening at an unconscious level, getting them comfortable
Mhm.
to move towards being able to identify things that they're
Right.
noticing in their body. But that will take as long as it takes.
Okay, yeah. And talk therapy can take, it depends on the individual how long that would take. So you can't
Right. I
really,
can't force
yeah,
that. I can't rush it.
exactly. And you can't put a time on it.
Right.
So talk therapy, what I'm hearing you say, will go hand in hand with
Absolutely.
the physical eye movements.
Correct.
Okay.
So then we go into the assessment phase. And this is part of it, right? Like I'm looking and saying, does the person have enough resources? We might do a couple of exercises to see how much tension they can tolerate and then bring themselves out of it, so that they can practice that at home, and that when we are in session, they feel like they have some control. They know that they're going to be okay. So once we get through that part of it, then it's where, and one interesting thing too, can people tolerate positive affect? Because for some, that may not be
They may
something
not
that they're used
recognize,
to.
right? If they're not experiencing
It wasn't what they grew up in.
Right.
Their bodies aren't used to it.
And what's an example of a positive affect?
Just a sense of trust and
Safety.
and safety, happiness.
Yes.
Like what makes you happy? And some people say, I don't know, because they've never been allowed to identify, well, here's my needs or my wants, and somebody is seeing me and willing to meet them.
Oh, that's
And
a
so
great point.
that
to feel
goes-
heard and to feel seen and to feel safe. What is that
Right.
for you? And if it's foreign, then that's something that you need to identify.
Exactly.
Mhm.
And that may be, in fact, what their trauma is. So when I use the word trauma, people think of big T stuff, car accidents or abusive situations. We all face different challenges and adversities, and they start in childhood, and it all goes back, all roads lead back to Rome, our families of
Yes.
origin.
Yes. And our attachment.
And our
Yes.
attachment. We have different attachment styles to each of our caregivers. So whoever our caregivers are, if we have one, two, or more, but they're going to
Yes.
be different with each of them. And it is those original caregivers, right? Like who are raising us, that are shaping our nervous system.
Yes.
They're starting to shape our beliefs.
Yes.
And
that's why attachment is
emotions.
so important. And
Yes.
you'll hear that time and time again, how important attachment is. And for you to understand attachment and to know your attachment style. And like or like Sandra said, all roads lead back to Rome. So that's really why it's so important to really have a good understanding of what your attachment is.
And Lana, it's funny because you just slipped into using my nickname, and
Yes.
because Lana and I are friends.
Yes.
My name translated from Sandra in Polish is Ola, and so my family and friends call me that. But professionally, I've always used Sandra.
Yes.
So just in case
That-
you're hearing
that is-
both names,
that-
that's
yeah.
where it's coming from.
Thank you for that, because it might slip again. All right. So sorry to get back on
Yeah.
track. So we
So
talked
we do
about
that
attachment.
assessment. Yeah.
Yes.
And so I'm looking for all of that in the assessment phase. And then I'm doing the preparation of getting things set up so that when we move into phase 4, which is the desensitization phase, so that's when we add the sets of bilateral stimulation. It's called dual attention stimulation, only meaning that whatever the bilateral is one portion of it. But because the therapist is here administering it to the client, that is also a way that the person is internal, but they have something externally to ground them.
Okay.
So it is that dual attention of I am going into the past, but I am still grounded here in the present.
Okay.
So that really distinguishes EMDR therapy from other type of trauma informed practices or modalities, because
yes.
while we need you to recall, you don't have to give a tremendous amount of details
Yes.
when we are looking for a target, because the goal is never to have someone relive their trauma.
You have to be so cautious about that. And
Right.
And I think that I love that about EMDR is that you don't have to retell your story over
Right.
and over
I
in
don't
detail.
need to know
you
the
don't
details.
need to know it.
So I'm looking around, and I may ask questions, but I will say, especially in the first couple of sessions, I don't need you to give me details, because I don't want them to walk out and start to feel flooded.
Yes.
Right. So this helps prevent that. And that's something different than like traumatic incident reprocessing. These are all very good modalities. So it's just what works for an individual.
Right.
But
right.
this is just a little bit more about EMDR. So we get into phase 4, we do the desensitization, we set it up. There is a whole script. and I'll talk about that later.
Okay. Yeah.
And then we use the bilateral stimulation. Then we get to a place, fifth phase, installation. So that's where we've gone through the various steps right in phase 4. And now the adaptive information is coming in. So I am going to help install that in the neural pathways. And I do that by changing the speed of the sets. So the sets will become shorter and slower.
So what's the set?
So a set is I will do 24 passes
Okay.
in one set. And I
Okay.
can talk more about that. And so when it
Passes
comes
meaning movement of your fingers?
of my hand
Okay.
and watching the person's eyes.
Okay.
And so there's a whole lot of things that I'm watching for
Okay.
when that's happening. But I go through the set, ask what's going on, what are they noticing, grab a snapshot, and then go on. So in installation, we want to make sure that this adaptive information, like the person goes, I wasn't responsible for this happening to me when I was a child because I was a child
Yes.
and I didn't cause this, or I didn't deserve that, or it doesn't make me unlovable. So I'm using a shorter set with more slower hand movements so that the body can continue to absorb that information and feel the tension that has dissipated, right? There's a more relaxed state.
Yeah.
If something comes up, that's just telling me, okay, we haven't cleaned out that neural pathway.
Okay. Then
So
do you spend
then
more
we can
time
look
there?
at more time.
Okay.
Yeah. So installation, and then we go into the final phase. There would be the body scan. That's where I'm having the client come back and just do as it says, body scan. What are they noticing? If there's a reduction, we want to keep the
Where
reduction.
are they
of,
feeling sensations in certain parts of their
Yes.
body?
and has the tension dissipated? So rather than
Yeah.
calling it an emotion of
Yeah.
has the anger or sadness or fear dissipated, it's more has the tension. Do you feel less
Okay.
tension? Do you feel more relaxed?
Okay. And is tension and like sometimes even when I'm trying to relax, I feel more tension in my jaw or I feel more tension in my shoulders. Are there certain areas that they should be paying attention to more
It's
than
just
others?
noticing wherever it is,
Okay.
because it can show up anywhere.
Yeah. Okay.
And so it's just okay if you're noticing it in your jaw or in your shoulders, in your chest, in
Or
your
that
gut.
stomach. Yeah, the stomach where
It's-
your
we're a
second brain.
huge carrier
Yeah.
there, right? So we do that. Then we get into closure and just shutting the reprocessing down, and we've done the installation, and then we reevaluate. Okay, it seems like these neural pathways have been cleared out, and is that enough, or are we looking at developing the next target? Is there
Okay.
another incident? Is there some other issue that still has a lot of tension for the client or still has traumatic memories? And so we would go back and do the process over again.
Okay. So would that be the step 8?
Those are the 8 phases.
okay.
Yes.
Would
and-
it be appropriate right now to talk about polyvagal?
Not
Yeah.
quite yet.
Okay.
Because
That's later.
I think that's where when I'm looking at the assessment and setting it up. So if you're considering that like in a triangular way, and in the middle of that is the intersubjectivity. So that is what is happening between myself and the client. I'm here as an anchor. My nervous system is in a calm place,
Yes.
so that's the energy I am projecting for that person to know, okay, this is okay. So when I start to feel elevated and if I start to feel fearful, I'm wanting them to go, okay, how are you noticing that? If you're labeling it as fear, where is that
Yes.
in your body? When, and then if they can tolerate it, when was another time? I'll go back. There's a float back technique within EMDR therapy. When did you feel that feeling before? When did you feel that sensation? If you can't completely identify it, when did you just notice this feeling before? Was there another time earlier than that? Was there another time earlier?
And how far back do you go?
Oftentimes we're going to go back to childhood,
Okay.
right?
Yeah.
Because that's where things start. That's where our foundational layers start. And, some people have much more challenging childhoods than others. But even for people who come in, and I always find this interesting. So when I start to do my history taking, and I'll say, so tell me about your childhood and your family of origin. And if I get the
Everything
response,
was great?
everything was great. I had a great
Yes.
childhood.
Then you're like, let's unpack that.
Okay, boy, they're going to be surprised at what we unpack. And it's not because I'm digging around to look and place judgment and
No.
say, oh,
But
your
it helps-
caregivers were terrible.
Right.
It is,
It helps your journey to healing if you can figure out what was happening there.
there were inevitably, this is human nature. We had needs that were not met. And it's much more tricky. We were able to say, oh, I had all my basic needs met. Well, that doesn't mean all your emotional needs were met.
Yes.
And so what emotional wounds are there, and that's what we look to heal. That's
Right.
the dance we do in every relationship.
Yes. So the unhealed parts of yourself are what you need to identify so that you can move on to the next phase.
And you just mentioned something that is very interesting, and I really would like to be able to touch on it.
Sure.
With in our time together.
Yeah.
Is parts work.
Yes. Tell me about that.
That's through structural. Well, my training came with structural dissociative theory, and my trainer for EMDR therapy, Kathleen Martin, who is
God,
exceptional.
She knows so much. Okay.
Yeah. So she said, you have to do this additional training as well to learn about structural dissociative theory and parts work. And so I introduce this to everyone because it's also a way to help us understand what's going on in our nervous systems.
Is it also called an internal family system?
Yes,
Okay.
that's an alternative. So there's
you might-
internal family systems,
Okay.
there's ego state work, inner child work, but the training that I took with Kathleen Martin was this structural dissociation
Okay.
theory. But I'm going to do one step back first.
Yes.
Because it'll give us a little bit of information and it'll set this up a little bit better. So when clients come in that assessment that I'm doing and helping them resource, I talk about our window of tolerance. So anybody who's interested in that, you can Google it. And there's great things on Google that are very, very easy to understand.
What are we Googling?
Window of tolerance.
Window of tolerance. Okay.
And so think of ourselves and our system as a window. And emotionally, we want our window to be as wide open and flowing as possible. And so when it is, we feel like we are managing whatever life is throwing at us, right? Things are waving through, good or bad, whatever. But we're managing. When we start to feel less patience, less tolerance, we're getting more tense, right? That window's closing. Sometimes things can happen to us, and maybe it's a series of things or just a single event that might pop us out the top of our window. That throws us into hyper arousal. We're feeling very elevated. We're very emotional. Everybody around us knows that we're being emotional right now.
Right.
They can
I'm
see
triggered.
that. I'm triggered.
Yeah.
Right. On the other end of things, if we slide out the bottom of our window of tolerance, that's when we go into hypoarousal. That's where we are sloth-like. We have no energy. The world has become very heavy. We feel like we're wearing a wet blanket. We're feeling sad and depressed. We have a hard time feeling any happiness or connectedness. And
Now,
that can be quieter.
Do you think that that's from an overstimulated nervous system, or is it other?
It can be. It can be related to some mental health issues such as depression. It can be over time. Things start to build up, and finally the system is starting to collapse and feel a sense of overwhelm. Right. So there's that graph that you can see. that shows the window of tolerance. So we're always looking to try and keep our window as wide as possible.
And how do you do that?
And so that's where you grab those tools.
Okay.
So do I need something? Another thing that I love telling clients about that I myself have started using with regularity in the past couple of years, meditation, right?
It's so powerful and so underutilized.
And I'm not talking about sitting on the floor in a position and clearing your mind. I'm a person who has always struggled with my own anxiety. So for me to clear my mind that can run rampant, like just run and run.
Yeah.
So I like guided meditations.
Yes, I'm the same way. I love guided meditation. It helps really for me to focus because otherwise,
Focusing.
and I think with time you could switch to the not guided, but I really guided. I'm going to say if you're new to meditation, start with the guided meditation. I use this app, like it's called MEYA. No affiliation whatsoever, but I use it. I love it. And it's got different accents and different voices, men and women, and it talks you through how to calm your body.
Yeah. And I use Insight Timer. There's a free version. I have no affiliation. But they also have a paid version, like a yearly subscription, which I've recently switched to. And it just opens up more coursework. So you can do a 30-day course on something. But if you only have a few minutes, then you can do it. You don't have to have a special room. You don't have to have a special place. I do it in bed before I get out of bed.
Yeah.
Just starting my day off on a positive note.
Yeah.
Okay. So that's another big thing that I will help clients. Also,
or grounding. Do you ever talk about grounding with them?
Yes.
Like going outside in bare feet or
there's
using
an
a
element,
grounding
getting out
mat.
in nature.
Yeah.
Learning any type of, like if you can do a little bit of yoga, because yoga is a gentle way of helping you tune into your body without thinking of anything from the past. It's like when you were doing a pose, what you're becoming aware of is, where's my arm? Where are my arms in space?
Yeah.
Where are my legs? How am I moving my body? What does my body feel like without being in something in the past?
Right.
And it's all about breathing.
Yeah. And so these are great things you can just start right now to work on that window of tolerance for yourself.
Right. Exactly.
Yeah. Awesome. Okay.
And so, okay. So I lost my spot there.
Okay. We were talking about.
Sorry, that's my age.
No.
I got all excited about those other things.
So we were talking about window of tolerance.
Oh,
and
yes. Thank you.
The
because you were asking me about polyvagal theory and then
polyvagal. Yes.
So I teach people about the window of tolerance, and then I also relate that to thinking of our nervous system, because what does polyvagal mean and what does somatic work mean? So making this simple.
Say it again.
Just somatic theory, right?
Somatic theory. Okay.
And it's all about body work.
Yes. And somatic, just the name itself would tell me that it's to do with the body.
Correct.
Like the feelings in your body.
Right. And so there's different somatic exercises. Again, go on YouTube, go on the internet. There's all kinds of things there. But just to introduce people to this concept, again, there was a graph that I found, which was great, that showed the nervous system, the autonomic nervous system, as a ladder. So on this ladder at the top, we are in ventrivagal.
Okay.
And that means we are socially engaged. We feel like we're coping. Our window of tolerance is wide open. And then we have events starting to happen, right? And we have our autonomic responses, which we are born with: fight, flight, freeze, fawn, collapse.
So
that's like blinking. We're just born with these.
So you'll hear that often in language where we talk about fight or flight, freeze or fawn, is when your reaction to a situation.
Correct.
Right? So it also that response is triggered in your amygdala in your brain. So this is this portion.
What it's just helping us understand where we're getting people to think about that it's not just our cognitive thoughts, what's happening up here in our brains. It's noticing what's happening in our body. And those shifts can happen so quickly and we don't notice it. Like all of a sudden it's like, why am I so tense? So Ventrivagal at the top of the ladder. When we come down a couple of steps, we want to be in parasympathetic so that it's like rest and digest. But if we get a sense of, we feel some tension building, and there we may feel like, I feel like there's, risk, like something bad might happen. We're starting to move into the sympathetic portion, fight or flight. So we've come down a couple rungs, we're kind of in the middle, and we're just like, okay, we're having a little bit of a harder time managing at this point. When we kind of slide down, going into the basement, the final rungs of the ladder, this is dorsal vagal.
Okay.
And this is where our system is reading more collapse. That something is so threatening to us that our body can start to say, our nervous system can say, I'm shutting down. I'm just going to collapse.
When is the SOS point? Like, when is it like, oh, I'm here and it's time for help?
That you are, it's hard to think clearly. Your energy levels are very low. Like somebody in a car accident and they're stepping out and they're stunned, right? And you're trying to talk to them. Are you okay? Are you okay? And they can't answer you. There's a physical, biological thing that's happening. Like our hearing.
They're in freeze.
So our hearing changes, our ability to hear. So if somebody is there on that cusp for a longer period of time, in a dangerous environment, for those who are living in circumstances where there's intimate partner violence, or you live in a neighborhood where you were experiencing racism or a high crime rate. So many different communities can experience that kind of chronicity where you just never feel safe, right?
Yeah.
That's very, very taxing on your system.
Right.
When I see if a client is sharing with me, if they come in and something like that, then my nervous system, I'm just trying to bring them up. When you are with somebody who's experiencing something like that, like it's been an acute circumstance, talking to them in a calm fashion, helping them understand you are okay. You are okay right in this moment. You're okay.
You might see
there's somebody else here.
You might see that in session.
Yeah.
Right? You might see that come out in session.
And they could, because of their past experiences, if I can see that they are slipping into something from the past that has been quite traumatic, then I'm just helping them. It's through the tone of my voice. Tone of voice is one of our biggest triggers. Or not. Or it can be a soothing thing, or it can be a very triggering sort of circumstance.
Oh, that's interesting. Yeah.
Huge. So by people having those kind of little visual imagery things, right? Like they can go to, it helps them understand, where am I at? Where's my window of tolerance? Where am I at on this ladder?
Do you do polyvagal at the same time as EMDR, at the same time as talk therapy, or is it kind of jump back and forth? Is it a continuum?
It's all kind of in and out. So if we need something, but once they have those reference points, I can easily say to them, so where do you think you are in your window?
Okay.
Where do you think you are on the ladder?
Yeah.
And they can go, I'm here. So it's a way of that we can communicate, and it's not good or bad. There's no judgment on it.
And it's really about being present in what you're experiencing right now. And then you're able to recognize that and see, okay, this is what I'm seeing. Tell me where you are.
Right. And the language that we develop together, that way it's not feeling stigmatizing. Like, you don't have to feel good or bad about this. Like wherever you're at, okay, there's a reason. Let's explore that reason. Why is it happening right now? Okay. So that's just more of what anybody could experience in regular psychotherapy, talk therapy, right?
Yes.
I'm not doing necessarily any particular modality.
Right.
I am just attuned to you.
And going
that's
with
the
what
most
you
important
need.
piece.
Going with what you need. What do you need?
Right.
So then you're, as a therapist, you're reading that and
Right.
helping this person talk about what they need.
Right.
And tell you what they need.
And especially if they can't come have their own words. Right. So I'm watching what their body presentation is. I'm looking at the bigger movements. How are they sitting across from me? Right? Are they feeling closed up? Are they feeling anxious? Are they opening up? Are they starting to escalate? And our faces can tell us so much, like small movements. And that's really because of our EMDR training. That's what we are trained to look for.
Are you better in person, or can that be something done in a virtual session?
It's very interesting. I was supposed to do my training live in person. Kathleen Martin was being brought to Windsor through one of my colleague and friends, Giselle Harrison. Shout out to her because she's
Hi, Giselle.
Wonderful, wonderful therapist, and had brought EMDR therapy to our community. But so that was coming, and then we went into the pandemic. So it took a few months before Kathleen could get that organized, and we moved it on to online. And it was the most impactful training I have ever had, both professionally and how it has helped me personally. And it absolutely works online because we were shut down.
Yeah.
And so I was meeting also, all kinds of new clients during that time. And that was the only way that we could do it. It took a long time before we could go back in person. So yes, it can work, but I have to make sure that the person is set up on a screen so that I can
see their body,
their at least their face, and hopefully the top of their chest, because there can be a lot of small movements.
Yeah.
I don't need to see necessarily the bigger movements, but I need to see this much.
So you can, absolutely. That makes sense. So we talked a lot about EMDR and trauma.
Right.
And is there other, anxiety and phobias and that kind of stuff that would be appropriate for EMDR as well?
All of us have trauma.
Yeah, I guess. Yeah.
None of us get out of our childhoods unscathed. We can have wonderful caregivers doing their best. But these little adversities, what might be, a parent yelling at us, but at that particular age and stage was like, we remember it.
Yeah.
What you experienced, and we can experience something together. And how our systems, because our internal and external resources are different, we're going to respond to that event very differently. So it's good for
pretty much
anything. Now, unless a person, where I have to say, I don't know about this.
Yeah. Is there somebody that would not be good for this?
Say someone who is living with schizophrenia. I do not have enough knowledge around that. So that would be something that have to be further explored. I just don't have that information. Anybody who I would be concerned possibly moving towards a psychotic state, if there was something, or they have spoken about having psychosis in the past, I don't know that would be appropriate at that time. So it would be somebody much more skilled, like Kathleen Martin. She had worked with thousands of people. She would have more of that information, but today
or perhaps somebody that did have schizophrenia, what if they were in a place where they were more stable and the medication and treatment, and
it would have to be somebody who has more practice with that. It hasn't come across in my practice. I don't know that.
Yeah, no, that's fair.
But and in particular, because one thing that we moved away from is in parts work. That is something I also introduce to everyone early on, because EMDR cannot be done on your own. You need a therapist to help guide you with that.
Yes.
Parts work, I set it up through a visual imagery exercise. If a person finds it useful, then it is something that they can use every day on their own. But it provides me with a tremendous amount of information. And especially if we are able to get into that phase 4, where we do the desensitization and all of a sudden we come to a screeching halt, I'm like, okay, you know what? We're gonna jump out, and I'm gonna go back and do some more parts work because I need to do some exploration. So parts work, I will try and summarize this quickly. Um, when we are born, and we aren't born with a fully developed identity, right? As we go through our ages and stages, we're starting to develop emotions, beliefs, behaviors, language, and that's helping form our identity structure. So some of it is going to be nature, some of it is nurture. Who's in our environment? Who
Yes.
is taking care of us? Back to attachment.
Right. And the nature nurture debate, that's really not a debate, folks.
No.
It's always both. The answer is always both. So not a debate. Yeah.
So as we move along, when we're younger and we face certain challenges, and because certain things happen when we are little that it doesn't make sense to us, we don't have the life experience, we don't have the knowledge, and we may not understand, and we may not have external resources, our caregivers who are able to tune in, to be attuned with what our needs are. So they may not realize that they are doing something to us or neglecting to provide something to us. Right? And so that gets settled into our system, and we develop these internal emotional parts. So we have our core structure of who we are and who we grow up to be as a rational, reasonable adult.
Okay.
But in these stages and phases of our lives where we face adversities, and especially if they start to become, if it's acute or it's chronic, then we develop emotional parts. And these emotional parts help us manage whatever is going on in our environment. Okay.
Okay.
The more adversity that we face, so if we live in a circumstance where we may be facing things, so trauma can be, it's not just traumas as an acute circumstances.
Right.
Trauma can be defined, and this comes from a clinic in Springfield, Missouri, who I had done some training with. And they set up the definition of trauma being too much for too long. And that's more on abuse side, like where something's happening to you. Too little for too long, which is more on the neglect side.
Yeah.
Somebody doesn't recognize what you need, and so those needs aren't getting met. Or there's an acute circumstance.
Meaning it was just
Where everybody goes, oh, that's a big T trauma.
Yeah.
Okay. So it's a one-time event, and we can all come up with examples. Those are easy to identify. So we have these circumstances, and it may just be, when you think of a parent who is living with and having troubles with managing a mental illness, depression, bipolar disorder, personality disorder, right? And so their behavior may be a little bit more, create a more chaotic environment.
Yes.
And as a child, we don't understand that. It's just our norm. And we're just like...
And it's inconsistent for you.
It's inconsistent.
Yeah.
Right? Yeah. So we develop these emotional parts that help us manage our environment.
Yeah.
And survive. They are survival mechanisms. So as we age, we can hear these internal emotional parts. They will also at times help compartmentalize. If we have something that is just too much for our nervous systems,
put it in a box,
for our brains,
put it away.
We are containing it, and we are moving it away. So an emotional part may be holding on to that.
That's not always a good thing. Putting it in a box, putting it away, you have to process it later.
Right. So if we do that consciously, that can be a helpful tool. But when it happens like that, that means that tension goes and it gets filed away, and that part is holding on to it. And we are saying, we shun you. We don't want, you're ugly. We don't want you around. You create a lot of pain for us. It's still one body, one mind. So it's in us. That tension is housed, and it's housed in our nervous system.
Right.
Maybe housed as certain memories with images, maybe not, but it's certainly housed as tension with all the sensory information. So that's why we can hear something or see something and we get triggered because some of that information may have leaked out and we're triggered.
Yeah. Yeah.
So when we raise those emotional parts to a conscious awareness, we are talking to them every day, all the time anyway. If we can hear those voices and identify what their needs are, then we create a more cohesive,
right. So those things,
integrated
those unmet needs can sometimes come out in anxiety and phobias. So it's not necessarily that EMDR is treating just trauma. Those other things are symptoms of your trauma.
Right.
So hence, really, you can treat the other things with EMDR.
Yeah. Oh, yeah. But I need to know that parts are going to be on board with me.
Yes.
So it's funny. I will explain this to clients and say, when you come in, I know I'm talking to an internal family.
Yes.
There's the AMP, the apparently normal part, which is our cognitive rational self that goes out and gets things done. I get up and I brush my teeth and I get ready for work, and out the door I go, and I've got my list of things to do, and I come home and I take care of the family, whatever. That's the apparently normal part. But I have emotional parts underneath. How many I have? It's individualized. It's unique for every person. There's no right or wrong if you have a few or you have a few dozen. It doesn't speak to pathology. And they help. But when younger parts are still acting in a way that they had when those events were going on, and they haven't adapted to the fact that we have become adults and we have more external resources, we have gained life experience and knowledge to help us manage things better, then that's when I get triggered on something, I may react in a more immature fashion because that part felt something from the nervous system. It rang a bell. That part said, this is my job. I have to come to defend the system.
The unhealed part of you.
That unhealed part, I need to come to the system's defense.
Awesome.
So when I help somebody come into a visual imagery exercise, I set up a space. I try and have them visualize a space that is only for them, that is safe, and it is where their parts can come and there's going to be a discussion. And we want to know who those parts are, what their functions are, if they have names, if they have titles, if they have shapes, they can be whatever. I document that, and then I have conversations with them.
Yeah.
And at times people will say, Sandra, this feels crazy because you're telling me that I have voices in my head. Isn't that doesn't that mean there's something really wrong? No, it doesn't. So it's
okay. They're just parts
it's not
of you.
pathological.
They're parts
it is
of
parts
you that
of you.
are talking.
Yeah. Now, not everybody comes to this easily. Sometimes it doesn't happen. They can't hear a voice.
Yeah.
Then it's like, what?
It's a feeling.
It's a feeling.
Yeah.
Where is a sensation? Where do you notice something? And sometimes people can feel very startled by that. I am a very strong believer and have been since I became a social worker, but certainly when I became a therapist, I started doing private therapy. If I don't do work myself, then I shouldn't be in this zone.
Oh, no, yeah. The therapist needs a therapist, for sure.
Yeah. And anyone out there who is ever looking for any type of psychotherapy, that is a question that you have in your phone consultation. If you do not feel bad about that, because you want to know what that therapist's experiences are, what their knowledge base is. So you can ask that question.
Because Can you imagine being a therapist and going through everyone's experiences and not having a healing space for yourself? Like
You'll be a
that blows
sponge,
my
and
mind.
right, and then your
Yeah.
parts are going to be reacting to
Yeah,
that.
your nervous system's going
Right.
to be jacked.
Right. So I've done my own
Mhm.
work, and when I did
Mhm.
parts work with a therapist, and I remember coming in and
Mhm.
going, "Oh, I have another part that came out. This feels crazy. Am I crazy?" And she's like, "Sandra." I said, "I know it's not crazy." But thankfully, I had that experience. So when a client's sitting across from me saying, "Ooh, this feels weird." Yeah, I know.
Mhm.
But
I got you.
it
Yeah.
gives me it provides so many guideposts. And then when we get into that phase 4 of desensitizing, it really helps. Like if we get stuck, then I know to jump out and do some more work because I don't have the whole internal family on board.
Right.
Does that make sense?
Yes.
Okay.
Yes, absolutely. So Ola, I'm not sure if there's any last minute comments that you wanted to add, but I wanted to wrap things up and help our listeners maybe connect them to some resources of where they can find an EMDR therapist and what qualifications should they look for.
Okay. You can just go on Psychology Today or EMDR Canada or EMDR
Okay.
International,
Okay.
and you
The
will find
therapists
that.
are
Yeah,
listed
and
there.
it's not always social workers. You may come across people who have their qualifications are psychotherapists.
Okay. Yes. And that's okay too.
Oh, absolutely. Yep. If
The
they have the
training, yeah.
training, and there's different levels. They may be trained, they may be certified, they may be consultants.
What's the difference between the three?
It's just the level of amount of training that they have.
Okay. So what's the top level?
If you're a consultant, then you've done quite a bit of
Okay.
training
Then,
and work.
because
Yeah.
now people
And
can
you have so many
consult-
hours
People
and
consult with you.
Yes.
Oh yeah, that makes
Yeah.
sense.
Just quickly, did you want to
Yeah.
know what happens in a session? I know we've gone a little long on other things, but did you want to know what that script is?
Yeah, maybe. Oh yes, we did talk about a
Okay.
script. Yeah, sure.
Yeah. So let me go into my notes and grab that. So
Yeah.
because we are looking at time. And so when we get into like where it's being set up, and I know that a person is able to it's like, okay, we're going to be able to do this. There is a very particular script that Francine Shapiro, who created EMDR therapy, created for a particular reason because we are looking for the target. And so in order for us to get into the neural pathways that we want to for the process to happen, this is the recommendation. So you get in and I will say to somebody, this is what it's about. You've got the explanation. We set up a stop signal. You can either give me like a hand signal or say, I need to stop, whatever is comfortable for you. And that you can do that at any time. You are in control of the process. And that we are going to do sets. I have used predominantly hand movements. So I just help the person, I sit them, and then I get them set up. We go through it. We make sure that it's comfortable.
Yeah, I follow it.
And then I'm making sure that their eyes are going corner to corner, far enough. I explained how we're going to set it up. I'm going to go through so many sets. I'm going to stop, take a deep breath, and I'm going to quickly ask you, what are you getting or what are you noticing? This is where the train metaphor comes in. It's like you're sitting on a train, you're looking out the window, and we're going to stop at a station. I don't want you to get off.
Okay.
I want you to observe.
I'm on a train.
Yep.
Okay.
You're on a train. You're seeing lots of scenery go by.
Okay.
I need a 4x6 snapshot. I don't need the whole motion picture.
Okay.
I need the snapshot of what you saw,
Okay.
what you're getting, or what you're feeling.
Out the window.
Out the window.
Yeah.
Don't get off the train.
Okay.
Stay on the train with me. Then, so we do the sets and I'll stop and I'll say, what are you noticing? They give me the information and I'll say, okay, go with that or notice that. And we do the sets again. And then there are particular things that I'm watching for. I'm looking in the facial structure and listening to where the information is. What are they noticing? And that's informing me that things are happening or that the reprocessing is happening. What's coming up might not make any sense to you. It's making sense to me. I can hear the shifting, right?
Right.
So then, so I give the train metaphor. And then I say, okay, you need to have some tension. So what are we working on today? What's the issue? Do you have a particular moment a 4x6 snapshot of that time where that brings up the tension. Yes. Okay. Describe it to me. Okay. What about that? So now I want the negative cognition. When you see that snapshot, that image, what do you feel is negative about yourself right now? I feel weak. Okay. When this is healed, what is the positive thing that you want to feel about yourself? That's the positive cognition. I want to feel strong, that I can manage. Okay, I feel strong. So tell me now the next step is validity of positive cognition, the VOC. That's on a scale of 1 to 7. How true does that positive cognition feel right now? Well, I don't feel very strong. It feels like a 2. Okay. Mark that down. I want you up at a 7. So that's one of the guideposts for me. What is the emotion when you see that image, when you see that snapshot? What is the emotion that you're going through? I feel sad. Okay. Then I'm looking for the SUD, which is the subjective units of distress, or it's the level of disturbance. On a scale of 0 to 10, how strong is that disturbance that you're feeling right now?
Okay. You have to really, your client would have to have a lot of insight into that.
Yeah. It's
asking you to really report back.
And so the first time for the first target, I'm not going for a 10. I'm not going for an 8. I want a 6, a 5.
And do you keep
6.
notes of these posts, and is that what you work on later?
Oh, yes.
Okay.
Yeah. So I'm writing in between, right? Because it's a lot of information.
Yeah.
But that's why the importance of developing, we have a trusting relationship. So that person isn't really tuning in to me writing things down or, following a script. They're like, okay, I'm concentrating. So we get this, so we find the level of disturbance. And then I say, where are you noticing this sensation in your body? It's up here in my chest. Okay. I want you to hold on to that tension. I want you to have that incident. I want you to have that image. But as soon as we start the sets, let it go. Whatever comes in, the train is going down the track, let it go. So we start, stop. What do you notice? And then we just go through so many sets, and I'm looking at the time, and I'm looking for the spot. How are things moving? And then it's up to me. So a session could be 55 minutes. It could be an hour and a half. And I have to set that up, that if I am in that phase with client, then I have to make sure I'm not
for
in a 55.
scheduling.
It's not like,
Okay, our
I
time's
gotta
up,
go.
right? Yeah.
So when it comes to an end, like sort of, okay, I'm checking in, and then say, look, I'm only going to do a couple more sets and we're going to shut down. We haven't completed this. So are we closing an unfinished reprocessing?
Can that happen? Is
Yes.
that okay?
Yep.
Okay.
But then we're going to set it up that you may experience those things. So when we're closing it down, I will help them understand the reprocessing may continue. You may continue to have different things come up that don't make sense. Feel free, write them down.
Okay.
If there's any disturbance where you really start to feel like you're going back and reliving, use one of your tools to ground. And if necessary, that starts to be too overwhelming, then you contact me and I will help you ground. And we'll set up a plan.
Yeah.
The other thing would be then if it is going well, then one of the things, like I had mentioned earlier, we go through the rest of the phases.
Okay.
And then we get to reevaluation and then decide are you done? Do you want to go on another target?
Okay. All right. Let's wrap this up.
Yeah.
Looks like we're running out of time. So thank you so much, Sandra, for coming in today.
You're very welcome. It's such a big topic.
Yeah, it really is. We could talk for hours. So thank you so much for joining us for this powerful and eye-opening conversation. If EMDR is something you're curious about or considering, we hope this episode gave you clarity and encouragement. Big thanks to our guest, Sandra Pelka, for sharing her wisdom, experience, and heart. Before we leave today, I've got 3 fast takeaways from this episode. Number 1, EMDR is more than eye movements. It's structured, evidence-based therapy that helps your brain reprocess painful memories and reduce emotional distress. Number 2, you don't have to retell everything. EMDR doesn't require you to talk in detail about your trauma for it to be effective. And number 3, Well, it's not really just for trauma because really the other symptoms could be rooted in trauma, but EMDR can also help with anxiety, grief, phobias, and more. So if you're feeling stuck, it might be the missing piece in your healing journey. If you enjoyed this episode, please rate, review, and share Anchored Minds with somebody who might benefit. And I'd also love to hear from you. So drop your questions, your thoughts, personal experiences with EMDR in the comments, or send me a DM. I'll be doing an Unpack This post where we can continue the conversation. As always, stay open, stay anchored, and we'll see you next time. Thank you.